everyone. Welcome to the program What to Know. What to Know is a program presented by Togolese Diaspora Group. This program is to raise awareness, to inform, and to educate immigrants and refugees so they can well integrate their host community. So today we're going to talk about the importance of having family doctor here in the United States. Before we start, let me introduce myself. My name is Amavi Gamon. I'm founder and president of Togolese Diaspora Group. We have here two beautiful guests. I'm going to give them the floor to introduce themselves. Thank you, and again, welcome to the program.
Thank you. My name is Marceline Kubanisevo. I'm a family nurse practitioner. I'm happy to be here today. Thank you again.
Buenos días, estamos aquí en el programa ¿A qué a saber? Un programa que está hecho por los inmigrantes de Tokio y de los cuales nos informan, nos educan cómo solucionar los problemas y cómo integrarnos a la sociedad de Estados Unidos.
Thank you. As I have said, we're going to talk about the importance of having a family doctor, or the importance of having a primary care provider.
Estamos viendo la importancia que es tener un doctor general, un doctor que se encargue de nuestra salud.
So, what is a family doctor?
¿Podrías decirnos qué es un doctor general?
A primary care provider or a family doctor or a general practitioner, those are the names that people call those people. Are people who went to medical school or higher nursing school to take care of a population, whether younger or older people.
Un family doctor es una persona que se encarga de los jóvenes y los adultos, de todas las enfermedades en general.
So, family doctor are the doctor taking care of either kids or adults. They can treat either any people.
So, un doctor general es una persona que se encarga de los niños, de los adultos y de todas las enfermedades.
So, what is specific role?
¿Cuál es el rol que desempeñan los doctores generales?
The role of a primary care provider or GP or PCP is to care for a person in a preventative way.
Un doctor general es una persona que se encarga de prevenirnos de las enfermedades.
It is to teach a person about better lifestyle choices.
Y enseñarnos cómo seguir las medidas para una buena salud.
He's there to treat common chronic issues like diabetes or hypertension.
Están ahí para tratar las enfermedades comunes.
That person is also the one who can determine if you are about to develop a chronic disease.
Esas personas also también se encargan de decirnos si estamos a punto de desarrollar una enfermedad crónica.
And he can refer you to a specialist
Nos
when you
refieren
need
a un
it.
especialista.
Okay, so a family doctor treats sicknesses, right?
Mm-hmm.
So why do I need a family doctor? I can just go to the hospital when I'm sick. Why do we need to have a family doctor, or why do we need to have a primary care provider?
Un doctor familiar es una persona que se encarga de todas las enfermedades en general, pero necesitamos saber por qué necesitamos un doctor general, si podemos ir al hospital simplemente, pero ¿por qué necesitamos un doctor general?
Again, the primary care provider is one that can treat chronic diseases, okay? But you need that person instead of going to the emergency room, because going to the emergency room is costly.
Un doctor general nos previene de irnos directamente a una emergencia. Ir a una emergencia nos cuesta mucho dinero.
You usually don't want anything happening to you where that can cause your death.
Por supuesto que no queremos que nos pase algo antes que nos pase la muerte.
The primary care provider can order lab testing that can determine diseases that you might develop in the future.
Un doctor familiar puede ordenar exámenes de sangre que nos previene de que una enfermedad grave.
Okay, thank you very much for the answer.
Muchas gracias por las preguntas.
So it's very important to have family doctor because it's gonna help us to prevent sicknesses. Sometimes there can be some sicknesses hidden in our body. So having the primary doctor, having a primary care provider or family doctor will help us to avoid the worst, to prevent those sicknesses.
Teniendo un doctor general nos previene de las enfermedades que están ocultas
So if
y nos
somebody,
previene de una enfermedad grave.
so if somebody is watching us right now and they are just asking, how can I find a family doctor? How can somebody find a family doctor?
Si una persona nos está viendo ahorita y ellos se preguntan cómo podemos encontrar un doctor general,
Most of us are workers and we have insurance. Usually our insurance network have a list of the people we can see.
la mayoría de nosotros tenemos un trabajo y tenemos una aseguranza. Si nosotros vamos a la internet, nosotros podemos ver cuáles doctores cubre la aseguranza.
We can also talk to our friends,
También podemos preguntar a los familiares, a los amigos,
other nurses we know.
o las enfermedades que conocemos.
Maybe they have a provider that they like or who is good, and we can go see that
A lo mejor
person.
un amigo tiene un doctor que es bueno y que nos lo puede recomendar.
We can also call some hospital and ask them if they
También podemos
have
hablar al hospital y que
providers who are taking new
cuáles son
patients.
los doctores generales que están disponibles que nos recomienden.
Thank you so much.
Gracias, muchas gracias.
You have said that if somebody watching us right now and they want to have a family doctor, so they can talk to a friend, they can ask a friend that already have family doctor, or they can call their insurance company. They're gonna provide them with they're gonna guide them having a family doctor, or they can call a hospital near them and asking for family doctor. So
Sí, como ya lo mencionamos, para encontrar un doctor general podemos hablar al hospital que nos recomienden uno, podemos decirle a nuestros amigos, podemos ir al internet para buscar uno, o sea, como ya lo repetimos, esas son las formas de encontrar un doctor general.
my next question to you is
La
that
próxima pregunta es,
does it pay to have a family doctor? We know that here in United States we have bills almost every day or every month. So does it pay to, do I have to pay every month for having a family doctor?
¿piensas que es importante que tengamos un doctor general o que es importante porque aquí tenemos muchos billes y pensamos que si tenemos un doctor general vamos a tener un bill cada mes? ¿Qué nos sugieres?
We all know everybody is scared of bills, yes, for sure. But having a primary care provider doesn't mean that you are going to be billed every month just because you have a primary care provider.
Teniendo un doctor general, eso nos quiere decir que vamos a tener un bill cada mes.
You might get bills depending on what you had done, like labs or
Puedes
testing.
tener billes cuando, si te hacen exámenes de sangre, si te hacen el RAIS, es cuando puedes tener un bill que no te cubra lo que no te cubra la aseguranza.
But seeing your primary care provider once a year for preventative visit should not be billed to you. Your insurance should take care of it.
Pero teniendo un doctor y visitándolo 1 o 2 veces al año, no vas a tener un bill que te va a llegar cada mes. Tu aseguranza se va a hacer cargo de tus billes.
So happy to hear that. So you
Muy
have
feliz
said that
de oír eso.
you have said that having family doctor won't cost us to have bills every month. Oh, that's a good news. So we know that many people like to have free stuff, but since having family doctor does not cost us to have bills every month, or to it's kind of the insurance gonna take care of our regular visits. So how often do I need to visit my family doctor?
Como ya vimos que teniendo un doctor general no vamos a tener un bill cada mes y que la aseguranza se va a encargar de nuestro bill. So, ¿qué nos recomiendas? ¿Qué tan seguido podemos ver al especialista, al doctor general?
A person can see their family doctor yearly or twice a year. or more often if they
Una
have
persona puede
chronic
ver su
issues.
doctor una o dos veces al año.
Okay, so we can visit our family doctor either once a year or twice or 3 times depending on our health issue.
Podemos visitarlo una o dos veces o 3 veces, depende de la salud.
So when do I need to visit my family doctor?
¿Cuándo necesito visitar mi doctor general?
It's when I'm sick that I call them to a visit,
Cuando estoy enfermo o cuando estoy bien.
or I can just call to schedule a visit just when, even when I'm feeling very
O
well.
puedo hablar y hacer una cita even cuando estoy bien, cuando estoy saludable.
You can visit your primary care provider or family doctor when you are in good health. That will be the preventive
Puedes visitar tu
visit.
doctor general cuando estás en buena salud.
You can visit them when you have issues like infection,
También puedes
headache, or anything
visitarlo
like
cuando
that.
tienes unas infecciones, un dolor de cabeza.
Okay, thank you very much.
Gracias, muchas gracias.
So can we have, you have said that it does not cost to have a family doctor. So can we have 2 or 3 family doctors at a time?
Como ya nos dijiste que no nos cuesta mucho tener un doctor familiar, podemos tener 1 o 2 doctores familiares a la vez.
Normally, a person should only have one primary care provider.
Normalmente una persona tiene uno por
Because
familia.
that primary care provider is the one who knows you.
Ya ese doctor ya te conoce, ya conoce tu historia.
He's the one who knows your health histories, all of
Él
that.
conoce tu historia de salud.
Just one is what you need.
Solo uno que necesitas uno.
But you can have multiple specialists
Pero puedes tener múltiples
for different health issues.
por diferentes enfermedades.
Somebody can have 2 primary care
Otros
providers
pueden tener 2
in cases where,
en caso de que,
like the people who retire in, let's say, Illinois or Iowa,
en caso de que las personas se retiren y se vayan a
and
diferente
they
estado.
usually live during the winter for like Arizona or Florida.
Usualmente se van en tiempo de calor a otro
Those
estado.
people can have a primary care provider here
Esas personas
in the
deben de
Quad
tener
Cities,
dos doctores
and then
generales.
have a primary care provider in,
Por ejemplo, en los
the
Quad
south of
Cities,
Florida.
en Florida o donde vivan.
because they usually spend maybe 6 months here and 6 months there.
Porque usualmente pasan 6 meses aquí y 6 meses en otra parte.
So if they have some health issues, they don't need to travel back here to get that address.
So, si tienen problemas de salud, no necesitan viajar tan lejos para visitar a su doctor. Tienen que tener dos doctores en diferentes estados.
So in those cases, there might be 2
En
primary
ese
care
caso
providers.
es perfecto tener 2.
Thank you very much.
Gracias, muchas gracias.
So you mean we can have 2 family doctors, but we can have it when we live, some people they live in 2 different states, so it can happen. Otherwise, normally we can only have 1 primary care provider.
Sí, como ya dijimos, nada más podemos tener uno, pero en caso de que viajemos o vivamos en dos estados diferentes, podemos tener 2.
But we can have many specialists depending on our health issues.
Pero podemos tener varios especialistas dependiendo de la salud.
So my next question for you.
La última pregunta para mí.
What somebody needs to do when they are sick? Do they need to call their primary care provider or their family doctor to tell them they are sick before they go to emergency room, or they need to just go to the emergency room and then after schedule an appointment with their family doctor? When somebody is sick, what they need to do?
¿Qué es lo que podemos hacer si una persona está enferma? ¿Irnos a emergencia o qué es lo que nos recomienda?
When you are sick, you don't need to call your primary care provider before going to the emergency room, but it depends on what's happening.
Okay.
Cuando estás enfermo, no necesitas hablarle a tu doctor general. Si estás realmente enfermo, pues depende de lo que esté pasando.
So in cases of life or death,
En caso de vida y muerte,
you cannot breathe.
que no
or
puedes
you're having
respirar,
maybe a heart attack.
que tienes un ataque del corazón.
You just call 911 or somebody
Solo
drives you
habla
to the
al
emergency room.
911 y ellos te atienden.
If you only have maybe like a headache
Si
that
tienes
has been
solamente
going
un
for a
dolor de
couple of days,
cabeza
you
o-
can call your primary care provider and see
O
that
algún
person.
dolor, háblale a tu doctor y haz una cita.
You have to see what's happening.
Depende de lo que esté pasando.
If it is an emergent case,
Si es
you
una
go to the
emergencia,
ER, and then afterward you follow up with your
Vete de
primary
inmediato
care
al
provider.
hospital.
Okay, thank you very much. So when we are sick, if we think like if this is an emergency, we just need to run to emergency room. But when we think that we can handle this sickness maybe for a couple hours or maybe for one day, maybe for 2 days, we can just call our family doctor and have an appointment and go visit them.
Sí, como ya dijimos, si es una emergencia tenemos que irnos, pero si vemos que es algo que lo podemos tener por 2 o 3 días, podemos hablar al doctor y hacer una cita.
Thank you so much.
Muchas gracias.
So today we talking about the importance of having family doctor. We can see that it's very important to have family doctor.
Ahora estamos viendo la importancia que es tener un doctor familiar.
First of all, it helps to prevent sicknesses
Primero nos ayuda a prevenir las enfermedades crónicas.
that we don't even know that they are hidden in our body.
No, porque no sabemos que están esas enfermedades escondidas en nuestro cuerpo.
Because sometimes you might think you are healthy,
Sometimes tú piensas que estás saludable,
but there is a sickness inside you that
pero hay
is
unas
coming
enfermedades escondidas
that you don't even know.
que no sabes.
But having a family doctor will help you
Pero teniendo un doctor familiar te ayuda
to detect this sickness
para detectarla antes de que sea tarde,
and to prevent it as soon as
para
possible.
prevenirla también.
Even having a family doctor will help you to have medical record.
Teniendo un doctor general nos ayuda a tener la salud de nuestra historia.
Sometimes you get sick and
Historia de nuestra salud.
sometimes you get sick and you can't even talk.
Algunas veces nos enfermamos y no podemos ni hablar.
But when you have a family doctor, they already have your medical record,
Cuando tenemos un doctor general, ellos saben ya nuestra historia.
and your record will talk in your place.
So, ya sabemos qué es lo que está pasando.
Your medical record will tell your doctor if you are allergic to this medicine, if they can give you this shot or not.
Los doctores ya saben que si eres alérgico a alguna medicina, si te pueden dar una medicina o no te la pueden dar, ellos ya saben porque tienen tu historia.
And this will allow your doctor to treat you better.
Eso nos permite que los doctores nos traten mejor, que tengamos un mejor trato en las enfermedades.
So it is very important to have a family doctor.
So, tenemos que estar conscientes que es bien importante que tengamos un doctor general.
We came to United States to have a better life and better opportunities.
Vinimos aquí para tener una vida mejor y unas oportunidades mejor.
How can we enjoy this better life if we are not healthy?
¿Cómo vamos a disfrutar la vida mejor si no estamos saludables?
Last time there is a friend in the community.
Hay una persona en la comunidad.
They were asked by he was asked by his company to see a psychiatric because he was having some kind of issues.
La compañía le dijo que viera un especialista porque tenía unos problemas de salud.
When we called the hospital
Cuando hablamos al hospital
to have an appointment with a psychiatric,
para hacer una cita con el especialista,
they told us that we need to go through his family doctor.
pero ellos dijeron que tenemos que irnos primero con el doctor general.
But he didn't have a family
Pero no
doctor.
tenía un doctor general.
So we have to look for a family doctor for him.
So, tuvimos que encontrarle un doctor general.
So when we call to have a family doctor,
Cuando hablamos para encontrarle un doctor
they
general,
give us appointments in 2 months.
nos dio una cita en 2 meses.
So we asked them to find us a way so he can be seen as earlier as possible, but there was no way, and they told us that we have to call every day if somebody cancel their appointment, so we're gonna have a chance to have him being seen.
So nos dijeron que habláramos todos los días para ver si había un lugar disponible.
That's what we did, but
Lo hicimos, todos los días estábamos hablando,
even this took a little longer.
pero tomó mucho tiempo.
So even all this time waiting to see a family doctor,
Todo ese tiempo para esperar a un doctor familiar,
our friend could, this sickness could harm him or could get worse.
so, la enfermedad se estaba empeorando.
Then after we have scheduled appointment with the family
Después que
doctor,
hicimos una
and we
cita,
went to see him.
fuimos a verlo,
Even that day, he didn't refer us to the psychiatrist
y ese día que teníamos la cita con el
that
doctor
he has
general,
to visit for the
todavía
first one.
no nos refirió al especialista.
He did some labs
Le hizo unos exámenes de sangre
and gave us another appointment.
y nos dio otra cita.
And we have to go back to the family doctor another day.
Al doctor familiar otro día.
And then it's after then he referred us to see the psychiatrist
Después de eso nos refirió a un
our
especialista.
friend knew to see. So all this took a while
Todo ese tiempo que perdimos
because he didn't have a family
porque no
doctor.
teníamos no tenía un doctor.
At the same time, he couldn't go to work.
Al mismo tiempo no podía ir a trabajar.
He's not getting paid.
No le estaban pagando,
He has bills to pay.
tenía biles que pagar,
He has to pay his rent.
tenía que pagar su renta.
And even when we went to the hospital to have a medical note so we can apply for him so he can get help to pay his rent, it wasn't possible because it's his fault that he didn't have a family doctor.
So, tratamos de encontrar ayuda económica para él, pero no fue posible porque no tenía un doctor familiar, era su culpa de él.
So it's very important to have a family doctor. We came here to work, and how you can work if you are not healthy.
Estamos aquí vinimos para trabajar. ¿Cómo vamos a trabajar si no estamos saludables? Es bien importante que tengamos un doctor general.
The company where we work at, they hire us so we can be on our job every day.
Las compañías nos contrataron para estar aquí, estemos todos los días, que estemos saludables. Pero ¿cómo si no estamos saludables? ¿Cómo vamos a trabajar?
They hire us because they need us every day. So it's not like we staying home 2 months waiting to have appointment with family doctor.
So, nos contrataron para ir todos los días.
So it's very
No podemos
important.
estarnos en la casa esperando por la cita del especialista.
So let us do ourselves a favor.
Vamos a hacernos un favor a nosotros mismos.
As Marceline said, we just right now need to call a hospital near us to ask them to have a family doctor.
Como nos dijo Marcelina, podemos hablar al hospital para que nos recomienden un doctor general.
They might tell you their list is full right now. Their doctor there are not receiving new patients.
Nos van a decir que está lleno, que no hay lugar.
But for sure, they will give you a number to call.
Pero por lo seguro nos van a dar un número para hablar.
And you will surely end up having a family doctor.
Tarde o temprano vamos a tener un doctor general.
As the nurse said, it just costs you to have at least one visit a year.
Como la enfermera nos dice, por lo menos una visita al año.
So please, it's very important to have family doctor.
Por favor, tenemos que entender que es bien importante que tengamos un doctor general, no importa la edad que tengamos.
To prevent sicknesses,
Para prevenir las enfermedades,
to stay healthy all the time,
estar saludables todo el tiempo
and to avoid the worst.
y evitar lo peor, que es una enfermedad crónica.
Thank you so much.
Gracias, muchas gracias.
I'm gonna give the floor to the nurse
Vamos a dar un aplauso a la enfermera
to
Marcelina
conclude the program.
para que concluya el programa.
Thank you.
Muchas gracias.
Really, I'm really blessed to be here today and
Es una bendición que estemos aquí
educate our community.
y que estemos educando a la comunidad.
Our president has said
Por
most of
nuestra
it.
presidenta Mavi,
It is really important to have a primary care provider
Es bien importante que tengamos un
or to have
doctor
somebody
primario,
who knows you
alguien que te conoce, que conoce tus récords,
and can lead you on a better, healthy path.
que te lleve al camino de la salud.
It doesn't cost anything.
No te cuesta nada.
Our insurance are covering most of it.
La aseguranza te cubre la mayor parte. Es muy poco lo que pagamos nosotros.
Thank you.
Gracias.
Thank you so much.
Gracias.
God bless you.
Dios los bendiga.
Thank you.